Okay, today I'm joined by Associate Professor Dr. Aziz Rahman. Aziz is an Associate Professor of Public Health at Federation University and the Associate Dean in Research in the School of Health. Aziz is a highly respected public health physician and researcher and has published over 90 research papers in highly ranked journals, including the New England Journal of Medicine, Lancet, British Medical Journal, and with over 18,000 citations. Aziz has also been very successful with fundings and has attracted more than $8 million in research funding in his career so far. And one of his key research area or research expertise is tobacco use. And this is something I'd like to talk to Aziz about today. So yeah, welcome Aziz. Thank you for coming.
Thanks, Michael, for inviting me for this session.
So when we talk about tobacco use, people often think about smoking a cigarette. However, there are other categories of tobacco use. Can you tell us about that, please?
Sure, Michael. So when you say about tobacco, usually we think of smoking, but there is another form of tobacco sometimes that is ignored or people are not aware of this. So basically, if we divide the tobacco, there are two forms. One is smoking, another one is called smokeless. And when you say about smoking, usually we think of cigarettes, but there are other forms of smoking that are also included within that smoking. That includes cigarettes, and there are sometimes hand rolls, tobacco leaves, that's called bidis, specifically quite common in South Asian settings. And it also includes some of the other forms of smoking, say, for example, shisha or water pipe, or the new trend is called vaping or e-cigarettes that we'll talk more. In terms of smokeless tobacco, what is from the term you can understand, so that means that is not smoked. So there are different forms of smokeless tobacco. One of these things is quite common in South Asian settings. That's called the smokeless chewing tobacco. So what they do, that form of tobacco is used usually with bitter leaves. They use this thing as one of the ingredients, and that is chewed. The other form that is quite common in Europe, that's called snus or snuff. So they keep this thing between cheek and gum and keep this in their oral cavity, and then they spit. So that is also another form of smokeless tobacco, and that is quite common, specifically in Sweden, Norway. They have been using this thing for hundreds of years. So that is also another form of tobacco.
Yeah, before we go on, I want to congratulate you on your recent publication in the Lancet Journal, a very, very high impact journal. And that was the work you've done with your tobacco collaborators group, and I'll provide a link of that paper to the Moodle shop for the student to access and have a read. But can you maybe summarize to us some of the key findings from this latest evidence?
Sure. So the studies that we conducted as one of the global collaborators, and that's called the Global Burden of Disease Study. So we estimated the prevalence of smoking tobacco and also the chewing tobacco use in 204 countries and territories, and we analyzed this thing according to age and sex. And we looked at the trend, what happened in 1990 up to 2019. So if we focus on smoking at first, so globally in 2019, and the total number of smokers were 1.14 billion individuals who were identified as current smokers. And if you look at the prevalence, always smoking prevalence is quite high among males. So the global prevalence was shown as 33% among males and 7% among females. And among the global tobacco use, some of the countries have really high prevalence, and we have identified that few countries that constitute about 2/3 of the global smokers. That included China, India, Indonesia, USA, and Russia. And there are a few other countries like Bangladesh, Japan, Turkey, Vietnam, and Philippines. So there are, if you go to the paper, you can see there are 10 countries that we have identified. They have the really high prevalence of smoking. And if we look at these smoking-related deaths, so in 2019, smoking tobacco use accounted for about 8 million deaths, and that smoking was the leading risk factor of deaths among males. Now, if you look at the smokeless tobacco or chewing tobacco use, so in 2019, about 274 million people use smokeless tobacco. Although the prevalence is really low compared to smoking, the prevalence was about 5%. But 83% of these smokeless tobacco users, chewing tobacco users, lived in South Asia. I must say this only includes the chewing tobacco, not the non-chewing tobacco that I mentioned in Europe. So 83% of these people lived in the South Asian region, and the biggest tobacco users, these chewing tobacco users, were from India. And there are a few other highest prevalence, there are a few other countries where the smokeless or chewing tobacco use was quite high. You can see we have identified about 12 countries, and you can see further details in the paper.
Great. That's really astonishing to hear the numbers in the different countries, and it's a major problem, isn't it? In the world, not just in Australia, but
it is. And sometimes we forget about these harmful effects when the 83% of these users living in South Asian settings, and they're having all of those effects and health effects of smokeless tobacco use.
Yeah, let's talk about some of the health issues associated with smoking or tobacco use, and one of the well-known and common one is lung cancer. Are there any evidence that links tobacco use to other diseases?
Sure. So when you say about health effects of tobacco use, basically we mean about the active smoking. So those who don't know, this tobacco smoking, when someone smokes, that smoke contains more than 4,000 chemicals in the cigarette smoking, and half of them are already there in the tobacco leaves, and half of them are created when there is a burning process in smoking. And some of the chemical compounds, those are introduced by manufacturer so that it is more addictive to the smokers and they can continue their smoking habit. And Michael, as you have mentioned, we all know about when we say about smoking, we say about, lung cancer, but there are other diseases in the body. And if you name any diseases, most of the non-communicable diseases are linked with this smoking. If we say about the main non-communicable diseases, including cardiovascular disease, cancer, chronic lung disease, and diabetes, smoking is the major key role player in that disease process. And if we look at the other diseases like dental problems, hearing loss, vision loss, fertility problem, osteoporosis, and there is consistent evidence among other cancers as well, like gastrointestinal cancers. So there is no evidence so far that it shows that smoking is helpful to our health. So all of the health effects that you can name off, those are linked with smoking either directly or indirectly.
You mentioned about active smoking. What about passive smoking or the effects of smoking? If you're around smokers.
Sure. So when we say about the passive smoking, there are two different terms that we use. One is called the secondhand smoke. That means when a smoker is smoking beside you, when you are not a smoker, so you can see that they exhale their smoke. So that is one type of smoke. The other thing is when they burn the cigarette, there is also the side stream smoke. So both of them are called the secondhand smoking exposure. So if you are a non-smoker, if you are beside a smoker, you can still inhale that secondhand smoke. And there is consistent evidence now regarding the health effects of secondhand smoking. If we start about this non-communicable disease that you have mentioned, there has been consistent evidence regarding the chronic heart disease or lung disease or lung cancer, ear disease, sudden infant death syndrome. And among the pregnant women, there's been consistent evidence that it affects the child in the womb of the mother, including in future low birth weight of those babies. So that is the effect of secondhand smoke, and there is no safety level of secondhand smoke, like how long you should be exposed to this. There is no safety level. If you are exposed to that secondhand smoke, you are more likely to get this health effect. So there is no safety level. You need to be very careful when, even if you're a non-smoker, you can be affected by this secondhand smoking. The other form of smoking that we mentioned in the passive smoking is called the third-hand smoking. So there is a new term that you may not be familiar with. So third-hand smoking is like this. I can give you an example so that you can relate with this. Say, for example, you are studying or you are at a place when you know that some of your friends or colleagues, they went out and then they smoked outside and then they came back to your office when they were not smoking. But you can feel that smoke, right? You can inhale that smoke. That's called the third-hand smoking. So that means when second-hand smoking is not there, even those chemical compounds, those are within their clothes, within their body, within the surface, and that can be inhaled, that can be ingested, that can be absorbed through the skin. So that is the danger of this third-hand smoking, and still research is going on regarding the health effects of third-hand smoking.
In terms of Australia, where we're living right now, from your research and your understanding, is there anything unique about the demographic patterns of tobacco use in Australia?
Sure. So the latest data from the National Drug Strategy Household Survey that was released last month, that provides us the latest evidence about tobacco use in Australia. And if you look at the data that showed that in 2019, smoking prevalence was about 12% among adults. And the daily smoking rate, although it has declined starting from 25% in 1991 to this almost 12% in 2019. The main concern is over the last 2-3 years that smoking decline is not that expected. It is not declining at the rate that we expected. So it is a bit static. So that is a concern. We need to work more on this. If you look at the demographic, Michael, that you have mentioned that some of the differences in demographics. So there is a difference in the age group. Unlike earlier data that we know that young people used to smoke more, but the latest data is showing the people in their 40s and 50s had the highest prevalence of daily smoking. And as we expected, men had the higher prevalence of smoking, like 13% compared to females, and the female smoking prevalence is really high, about 10%. In many parts of the world, you can see the smoking prevalence among females is lower than what we see in Australia. And now, in terms of some of the other characteristics that is a bit different in Australian settings, say, for example, people who live in the remote settings or in the rural settings, their smoking prevalence is higher compared to the people who live in metropolitan region. And the latest data shows that burden of disease and attributable to this remoteness is about 1.8 times compared to the people who lived in metropolitan region. So that is a big bit of concern. The other demographic that I can mention is about the socioeconomic status. It has been shown in the latest data, people who are living in the lower socioeconomic status areas, they are more prone to do smoking, and the disease burden is really high. And it is more than 2.6 times higher than the areas where people had higher socioeconomic status. So there is a variation of this remoteness, socioeconomic status, age, and gender in Australian smoking prevalence.
Great. Is there any reason or factors that contribute to the higher smoking rate in the remote region of Australia that you know of, or is that something that's still being investigated?
I think one of my PhD students who just going to finish this PhD, he looked at whether the tobacco retailer density has any association with smoking prevalence in regional settings. And he looked at the data at Bendigo. And it was shown, yes, there is a strong association among the smoking prevalence and tobacco retailer density. It is showed that if you have more tobacco retailer in the rural or regional settings, in those areas, smoking prevalence is high. So that is one of the evidence that I can share with you in terms of remoteness in Australia.
That's very interesting. My next question is about why tobacco smoking or tobacco use is so difficult to control. And obviously, I think you agree that it is a modifiable risk factor. And why do you think are the reasons why it is so difficult to control?
Sure. In terms of tobacco use, is a complex behavioral issue. Yes, you're right that it is a modifiable risk factor, and to change the behavior, it is really difficult. It is not an easy task to do. But we also need to think of what is that inside that tobacco that people are struggling to quit. And that is the key constituent, this nicotine. And nicotine is highly addictive substance. And evidence shows that this addictiveness is really high, even compared to the morphine, pethidine, all of these other opioids. So smokers, if you talk with the smokers, you can see that all of the smokers, they try to quit during their lifetime. But it is really difficult for them to quit. And it needs several cessation attempts before they successfully quit. And to assist their quitting attempt, we need to have the support for the smokers in terms of either medication and counseling. And it has been shown that the most effective approach is medication plus counseling. It is not only one way, just the medication or just the counseling. But there are some challenges in this, and if I say from Australian context, this medication support, these are not cheap option. So people need to pay out of pocket. So there is a challenge there. And people also have lack of motivation. You know, the quit line is available here. So people can call and they can have this guidance. But that motivation is not there. So still, I will say in Australia, they are doing really good. The prevalence is not that high compared to other in many countries. But still, there is a scope to improve these services so that people know that they are getting the adequate support.
What are some of the key public health strategies that have been used or implemented in the past with the end of reducing tobacco use in Australia and around the world? And also, why were they not successful?
Sure. World Health Organization has developed a strategy that's called Empower strategy, and that is there for many years now. So if we say about the Empower, so what does Empower mean? M means monitoring tobacco use and prevention policies. P means protect from tobacco smoke. O means offer help to quit tobacco use. W means warn about the dangers of tobacco. E means enforce bans on tobacco advertising, promotion, and sponsorship. And the last one, R, is called raising taxes on tobacco. Now, if you look at all of these components, we know that if we increase tax, that is the most effective strategy in any country, irrespective of the status of those countries, whether it is developed country or developing countries. If we increase the tax, the tobacco price will increase and people will reduce their smoking. So that is at the macro level. But if you look at the micro level, the most cost-effective option is to offer help to the smokers in terms of quitting smoking. And if we look at Australia, this low prevalence of 11%, definitely it is a combined efforts of the public health professionals as well as the policymakers, and there are fantastic policies in Australia. Australia is pioneer, I will say, in global tobacco control in many aspects. Say, for example, if you look at the plain packaging, so Australia was the first to introduce this plain packaging. There are some other tobacco control effort that I can mention, say for example, graphic warnings. You can look at the tobacco pack and graphic warnings are there. There has been consistent media campaigns, and nowadays the campaign is, tobacco causes, smoking causes sticky blood. So that is one of the latest campaign you can see in the media. There is also smoke-free policy, like in terms of outdoor smoking. There are different areas where there is smoke-free policies are there. There is an advertisement ban at the point of sales. If you go to different retail shops, you can't see all of this tobacco packaging. Unlike other countries, say for example, when I visited US and UK and other countries, all of these tobacco products are in display. But in Australia, we are successful in doing this thing. Although there is a doubt, not doubt, but there is an issue regarding the effectiveness of plain packaging, so that is under review at this moment. But we also need to think of what is the challenging issue is the big lobbying of the tobacco companies, because they have really strong, I will say, support to the government of any countries. And sometimes they use their direct tobacco tactics, for example, marketing advertisement. When it is banned, then they try to do something is called indirect tactics. Say, for example, they put this thing as a brand stretching. They don't use their name, but they do use their logo. They use their color. They sometimes sponsor different events. So there are different issues that it is always struggling, and they are really powerful. Sometimes in many countries, many tobacco companies are even owned by the government people. So it is really difficult for those countries to control. Say, for example, in China, many tobacco companies are owned by the ministers. So it is really difficult for them to control tobacco there.
Yeah, that sounds like a very, very complicated and convoluted issues with government and policies and big companies, and that's probably why this is still such a big problem around the world.
Indeed.
Yeah. The next thing I want to have a chat to you about is one of your area of interest is vaping, which you mentioned earlier. It's a form of tobacco use. I'm not very familiar with the vaping in terms of what it is. Can you maybe explain to the student what vaping is, and also some of the controversies surrounding vaping, which I know from talking to you previously, is that it has been potentially suggested as a way to stop smoking in terms of help smoking cessation. Maybe you can tell us about that.
Sure. So vaping, there are different terms that are used, and it's called e-cigarettes, electronic cigarettes, or vaping, or electronic nicotine delivery system. So ENDS. So there are different terms. Those are used in the literature if you look around. Now, this vaping is a new product in tobacco industry, and probably that has been invented about 10, 12 years ago. It's not that old product. So what vaping or e-cigarette is there's a liquid solution that is included within the device, and there is a battery. When we inhale, then it automatically charges that liquid solution and it produces a vapor. And when people inhale this thing, they get the feeling that they are doing the smoking, like they're smoking cigarettes, but it's not the smoking cigarettes. Now, if you look at the literature, and I will also share some of my publications there on vaping, and who are the people who used to do this vaping. So there are two groups of people. Usually, people use this thing as a matter of curiosity. It's a new product. Let's try this thing. And the other group of people who are smokers, they started using this product as a new out of curiosity, and then they found they were able to quit their own smoking habit, smoking cigarettes, by switching to this vaping. Now, when you look at the literature, there is the debate regarding this, whether we should, if people are using this thing to quit their smoking habit, which is really harmful. As I have mentioned previously, it contains more than 4,000 chemicals, whether switching to vaping is a good public health strategy. Now, if you look at the harmful effects of vaping, it is not harmless, but it contains less harmful products compared to smoking. In vaping, there has been consistent evidence regarding some of these things, some of the effects, like it causes irritation in the trachea or lungs, and there are some evidences coming. But we don't know the long-term health effects of vaping, so that is also one challenge. But so far, what you know, the toxicity of vaping is much less compared to cigarettes. Now, whether we should advise smokers to quit and then switch to this, there is a public health importance here, because smokers, as I mentioned, they try to quit, but they relapse. But when they relapse, it takes time. They try and it goes on. So whether we want the smokers to continue their smoking habit, or whether we want them to switch to a less harmful product that we call the harm reduction strategy. So if we reduce that harm at the population level, definitely the benefit at the population level is quite high by switching them to a less harmful product. However, if we say, okay, you can use this thing, the danger is, and why other group of public health professionals don't support this, is people may think, oh, okay, we can use this. And then many young people, that's happening at this moment, or the non-smoker, they can try these electronic cigarettes, and then they can switch to the normal cigarettes that we don't want at all. So what other countries have done, say for example in UK, smokers can request their general practitioners to prescribe them vaping so that they can use this thing. And there should be documented evidence that they tried nicotine replacement product and they failed, so they are trying this if they can switch. So that needs to be regulated. In Australia, we are not regulating this electronic cigarette products. There is a challenge. People can buy this thing from overseas and through internet. Although there is a new rule that's coming, and probably that is going to be effective from September, October this year, that people can't import the nicotine solution from overseas. Whereas there is a gap in the policy and the implications, because when anecdotal evidence shows that when you go to the tobacco shop, if you ask for the nicotine solution, which is illegal to be sold in Australia, but you can get those nicotine solution from those tobacco shops. There is a gap in the policy and the implication in the field. So that is one of the issues that we need to consider in future for the policy makers to consider. That needs to be regulated, and then we need to think of how people can get support from the general physician so that they can switch from smoking to this less harmful product. And I would like to remind you that is less harmful, that is not harmless to this vaping. But the issue is, and I'm pretty sure that many of you may be aware that at the school and the college, many young people in recent days, and not only in Melbourne, but in Queensland, we are seeing this report that students are using this vaping as a matter of curiosity, and they are thinking, oh, it's a cool image that used to happen when smoking started. So they thought, oh, okay, having this vaping is a cool effect. So that is the danger. We don't want the non-smokers to use this vaping. So it needs to be regulated strictly, and many people, including the policymakers, need to come forward to make it available only to the smokers, not to the non-smokers.
That's really, really informative, Aziz. Sounds like a very important and challenging problem that we have to address in the future about vaping. My next question is, let's assume that you can be Prime Minister for a whole month, taking over from Scott Morrison and being a public health expert and advocate. What would you do in terms of strategies and policy making you will put in place to ease the burden of tobacco use in Australia?
Yeah, I wish that I could get that opportunity, Michael. Smoking is a complex behavioral issue. So we can't say that one single strategy will work. So if I got that opportunity, probably my focus would be on three things. The first thing that I have mentioned that is really effective to increase tax. So, anecdotal evidence showed in Australia even people are decreasing their smoking because the price of cigarettes are going high now. So we really need to work on this thing to increase tax. I know that there'll be lots of challenges from the tobacco company. They will not allow this thing. But if I had that decision-making power, I would focus on this thing as the first thing. And the second thing that I will do to support the smoking cessation for the smokers. And as I mentioned, so I will introduce Medicare supported aid for smoking cessation, probably nicotine replacement therapy or vaping, whatever helps, or the free counseling for the smokers who really want to quit. And the third thing probably I will focus, because Australia is a multicultural country and many people come here with their habits of smoking from overseas. So we really need to engage multicultural community leaders in helping this issue. Australia is doing really good. The smoking prevalence is not that high, but still it is really high in different sectors, and as I mentioned, in different demographics and also probably different cultures. So if multicultural communities are engaged in this smoking cessation support, I guess that will be more effective. That's not happening at this moment.
Great, thank you. You sound like a true politician, Aziz.
Wish other politicians could think of these things so that I could get the opportunity to compete in the next election.
Yes, I'll vote for you for sure.
Thank you.
Okay, my last question before we wrap up the interview, Aziz, is obviously you know that the audience for this interview are allied health students from physiotherapy and occupational therapy in our school. Can you think of any way that allied health professionals, what role they can play in help controlling the tobacco use pandemic in Australia?
Thanks, Michael. So that's a really an important question. So any health professional, irrespective of whether they are the medical professional or from any health background, and the allied health professionals, anyone who get in touch with a patient every day in their professional practice, they have a significant role to play, and that is not happening in many parts of the world, including Australia. And I do understand that these health professionals are quite busy in their practice, but there has been consistent evidence on their role of smoking cessation support. And if you look at the evidence that I can share with you, that advice from a health professional is a powerful trigger for prompting quit attempts. And most of the research has been done looking at this smoking cessation advice from a physician or from a nurse. And it has been shown that patients expect their physicians to talk about their smoking habit. They expect that the physician will tell them to quit smoking, but their experience don't match with their expectations. So that is the challenge. And it has been shown that 1 in 5 unmotivated smokers will consider quitting if that has been told by a healthcare professional. So being an allied health professional, definitely each of the allied health professional has a significant role when they interact with the patient, asking this question, are you a smoker? And if they say yes, just referring them to the quit line, that simple message, it should not take more than 30 seconds of their time. If we utilize this thing, definitely the smoker patients will think twice, and that will prompt them to consider quitting. So that is the success. If each health professional can do this thing, probably we can do lots of role in playing the smoking cessation. I would also mention one thing, as I mentioned, most of the research has focused on the smoking cessation support from the physician point of view or from nursing point of view, but there is a lack of research whether the allied health professional, as you mentioned, Michael, the physiotherapists, the occupational therapists, they can also play a significant role. And there could be further research to check this effectiveness of their smoking cessation support towards the patient. And so I will say there is a further scope of doing research in that area.
Great, thank you. I think that's a very nice way to end the interview. And I think what you mentioned before about the role of allied health professionals in smoking cessation hasn't been researched very well. So it sounds like a master's PhD project in the making.
Of course, that's really lovely to look at this thing, because otherwise it is an untapped opportunity. So each of these health professionals, allied health professionals, can definitely play a significant role. And if they do their role, and if they get the same message from the health professionals like general practitioners, nurses, allied health professionals, so definitely there is a consistent percussion on their quit attempts, and that could lead to further success in Australia.
Great. Thank you very much, Aziz, for a wonderful, informative chat. And I will link some of your papers that you reference to the student for them to access. So thank you very much for joining us today.
Thank you, Michael, for inviting me. Really appreciate this. Thank you.
Thank you.